gentlemen, we are tonight focusing on the bitter truth behind the added sugar industry in India, particularly in the baby food industry. Union Minister J.P. Nadda has stated that the added sugar in Nestle baby products was in compliance with the Indian and global standards as per the Food Safety and Standard Regulation 2020. Not just that, he told the parliament that the limits specified for sugars in infant food products in the regulations was on par with the global standards, namely Codex Alimentarius Commission, which considered the recommendation of the World Health Organization while setting food standards. This comes months after the report that claimed Nestle's wheat-based product, Cerelac, for 6-month babies, which is sold without any added sugars in the UK and Germany, contained 2.7 grams of added sugar per serving in India, while there was none in countries like Germany. The report was by a Swiss NGO, Public Eye, and International Baby Food Action Network. So, what's the truth? Are Indian standards for sugar added to baby food and for processed food lower or at par with international standards? Remember, 12.5 million children in India have been found obese, according to a report by the Lancet, which looked at the numbers in 2022 compared to just 0.4 million in 1990. So look at this, the change in numbers. In 1990, you had 0.4 million obese children in India. And fast forward to 2022, look at the increase in numbers. 12.5 million children are obese. In fact, an earlier report of Lancet stated in the absence of stringent regulatory policies, the sugar content of processed foods, including the so-called healthy drinks for pregnant and lactating mothers, is quite high. Instant foods for babies aged 6 months and older are loaded with sugar. Similarly, sugary health drinks for children are marketed tactfully as promising to boost growth and strength. So does India need a relook? That's what we are going to be looking at tonight. I'm being joined by Dr. Sneha Sharma, who's a senior nutritionist, Mahesh Zagade, who's a former Mumbai Food Commissioner, Swati Mundhra, who's a parent and is living in Singapore, as well as Dr. Prashant Mehta, who's an oncologist and senior consultant at the Amrita Institute of Medical Sciences. Thank you very much, all of you, for joining us. Well, straight up, let me come to you, Dr. Sneha Sharma, first. What do you make out of this? Because there was such a furore. There's a very scathing report by a Swiss NGO that went on to say, look at the difference in a baby product, in a baby food that has been sold by a company. They add so much of added sugar. Nestle said it was less than 3 grams per portion. And in India, but they say there's no added sugar in countries in the Europe. So what is this about when the government says that it is according to the standards that India needs and that India recommends? Dr. Sneha. Dr. Sneha, this is for you. All right. I don't think we can hear this at this point. We'll try and get to Dr. Sneha at this point. We'll get to her in a bit, but if I can come to you straight at this point, Dr. Prashant Mehta, would you be able to decode this to us? So essentially, the government has said that all is well. It is according to the standards that are prescribed, and the government has gone ahead one more step to say that India has, the international standards, which is prescribed by Codex, as it were. So what is the truth behind this? Is India's acceptance of added sugar far higher than the rest of the countries?
So the government, in its, whatever has come out in the public domain, has not shared the exact numbers and the percentages which they have found actually in their, I did not find anywhere online that what exactly was found in the report actually. But I don't believe that there would be any difference in the international recommendations versus the Indian recommendations, and the criteria would not be different for any other country. Why such a step is being taken by Nestle that other countries the added sugar is lower or non-existent, but for India and some of the other countries it's higher? Is it related to the palatability? Is it related to the way our children actually like to have their food? Very difficult to say that. But what reason exactly do they give to have this difference and have these double standards? We need to look into that. And also, I would like to know the exact numbers which the Indian regulatory authorities have found. But that said, we have some recommendations with regard to the percentage of free sugar. Free sugar is actually the sugar which is in form of added
Hmm.
sugar or fruit juices or fruit concentrates, or in this form. If sugar is there in the processed food, that's free sugar. Other as opposed to intrinsic sugar, which actually can be found in natural fruits and natural vegetables, natural sources. So there is not no limit on that intrinsic sugar actually. But free sugar, which we are discussing today, we should, there are recommendations that we have to keep this below 10% of the daily calorie intake, and this is with regard to all ages. But now the international societies are talking about even more stringent limitations to the amount of sugar which we have as a percentage of our
Right.
daily calorie intake, to below 5%. So if you have below 5%, it's considered better
Hmm.
for in the long term respect. And you are likely to have less
Okay.
long term issues like childhood obesity or long term health problems in adulthood when you are fed less sugar and or
Hmm.
less added sugar or free sugar in childhood. But all said again, we need more those
That's
numbers more
interesting
clearly
because I would
to
like to
comment on that.
come back to you and spend a little more time on that also, because there's a lot which is being spoken about sugar also. There are a lot of recommendations about it also. I'll get back to you in a bit about that. But Swati Mundhra, if I can come in, it's interesting, and thank you very much for joining us, Swati, because you are a professional who is a full-time mom right now. You're based out of Singapore. You also make goodies and tasty, yummy food for children in Singapore, for toddlers as well. So you are well versed with the Indian market, you are well versed with the Singapore market. Do you see inherently any difference?
I think the difference is basically a lot of the mindset of parents and also in general the population, I would say, right? So, like my daughter, she's almost 3 years now, and she has not had added sugar in her diet. So until 2 years, she had no sugar, no salt in her diet, and it was only natural sugar that we gave her, and no one laughed at us when we did not give sugar to our children in Singapore. But when I talk to my relatives back in India, they find it very funny that my daughter has not had chocolates or candies. So I feel the general mindset is very important where we need to see a shift first.
I think you're saying a very important point, but it's not only about the parents' mindset, it's also about the ecosystem. So, before I go to the other panelists, very quickly, how does it work where you are? Do you have very clear food labelings? Do you have color codings? How intrinsic is it in a system? Like if you go to a supermarket and if you have to buy something that is processed, something that is packaged, say for a toddler, since you have a 3-year-old, do you have options that do not have added sugar? In India, you barely would have any.
We do have options without added sugar, but like India, also in Singapore, we do have a lot of baby food options which do have a certain portion or percentage of added sugar. So as parents, and also I think what during pregnancy or when you've conceived or even after you've conceived, during a breastfeeding journey, the doctors of your keep letting you know that breastfeeding is important. When you start your solids journey, do not give them
Hmm.
sugar. So it's also important that we educate our parents. And yes, most of the products in Singapore have labelings. They are graded A to E, and the A being the the best option with that, and then it's showing you how the healthier option, and then the sugar intake increases. So it is very important for you to read the ingredients, which is a fact and which is known over here. And
Hmm.
also most of the people are educated on these facts.
Very interesting, very interesting. Dr. Shikha Sharma, if you could come in. Dr. Shikha, you have a very important role here because you'll have to really break this down. We are quite in a limbo here. So people are saying Indian standards can't be lower than the international standards. And then you have a minister come on board and say that the product that the Cerelac, as it were, is very much according to the Indian standards. And then you have another aspect of it, which says that countries like in Europe, like Germany and all, they do not have added sugar added to the same product that is being sold. So what is it? Does India have a very different standard? If it doesn't, is it a mindset problem? Is it an ecosystem problem? Because, you know, a chocolate, one cake, I mean, you know, everybody says chalta hai. That's the least.
Yeah, so let's first break it down to what is scientifically right. So what is scientifically right is that babies do not need added sugar in any form, whether it is a fructose syrup or whether it's a corn syrup or any other, or honey in a processed form. Babies do not need that added sugar. It is not scientifically required. And that is why all pediatricians tell the parents that till 2 years, please do not give salt or sugar to the child, added salt or added sugar to the child. Now, once the science is there, now the second thing is when a global company, which has been in the business for years and years, comes up with a product to a parent, the parent will buy the product over anything else, thinking that this is better for my baby. If I'm spending that money, it is better from other things, from other foods which I am unable to provide. So even on that front, I would say there is no question that the product has to be in line with the medical standards and not just with the food standards. Because when we're talking about a small baby, we are talking about medical sciences. And we also know that the explosion of obesity all over the world is precisely because of these processed foods and sugar and salt in the food. Otherwise, there was no other reason for the for children to become so obese. Now, let's come to the third part, which is the food standards within our country. And why are they different from the standards in Europe or other places? Now, the question is that, yes, a company can say that we are adhering to your country's standards, and according to that, we are fine. But the question is that that product internationally is following a better standard. So if I'm buying a car in India, I don't expect the car to have less safety features than what they're giving in Europe. I would expect the same safety features, the same thing. So it is the same thing. I mean, it's a safety feature. Don't put sugar, don't put all those things which are not required, irrespective of whether India has, the regulatory body has a more relaxed standard. But the company, the brand has to maintain its standard globally. And I would say that this is definitely double standards.
Interesting that you say that. If I can very quickly get in Mr. Mahesh Zagare. Mahesh Zagare, you've also been a former Mumbai food commissioner. How would you respond to this? People are saying this is nothing short of double standards. This is nothing short of, this is literally differentiation, discrimination based on countries. And these are corporates. I'm not singling out any one company because let's face the fact, if you go across to a supermarket, if you go to any store, these are big giants that have huge amount of spending on R&D. So are we then saying India has a very different standard than the West? Would you agree to what Dr. Shikha just said?
Sneha, let me have the basics first. One thing is that, what standards we are following is the Codex Alimentarius Commission standard, which is applicable to all across the globe. And since we are the member of the WHO, World Health Organization, and Food and Agriculture Organization, which has floated the Alimentarius Commission, the Codex Alimentarius Commission, they set the standards for food across all the countries. Now, India has also adopted that. Now, if you are coming basically to the infant nutrition, we have exactly adopted STAN 72/1981 standards for infants, and they are exactly same. And most of the advanced countries, developed nations, they have the same standards. Now, what are these standards? They're saying that the sugar content in the baby food shall be either the polymers of lactose or glucose, and they should not be sucrose and the fructose. And if at all these added sugars are to be there, then they should not be more than 20% of the total carbohydrate requirements. Now, this is the basic of it. We in India are compliant about this, but we are taking a
which is now reduced by
narrow
WHO to 10% of total carbohydrates. But please go ahead.
This very narrow view we are taking. The kind of assault of sugar that is happening on humanity and countries like us, is humongous. Now we are singling out this particular brand, but if you take about I would not say shy from taking the names like Horlicks or Bonvita and all that. These also contain loads of sugar. Apart from that, any mother in India, especially in rural areas, they give milk to their babies, but they add sugar to it. Now there is nothing about that. So there is assault, and this assault is going in a way that we are following the Western world, especially USA. And USA, the obesity is mainly led by the carbohydrates, and especially sucrose. That is, and if you see the Corona window, during that time, this obesity was one of the major factors where the mortality was more, the fertility was more. So we are going in that direction. I think for 2 lakh years, humanity was without any processed food or the fine sugar. For last 3,000 to 5,000 years, we have started using sugar. I think we need to go to
Okay.
basics and avoid
Okay.
this all across, not just this. And this is going to create havoc. If you ask me whether we are standard compliant, yes, we are compliant of the international standards, but just not just, this is a very small window. All across, there are so many processed things, added your salt in butter that we are giving it to babies. There's so many things. So we need to again revisit what we are
Okay.
doing, or we are going the wrong way that USA has gone.
Dr. Shikha Sharma, I mean, just look at the obesity pandemic. Forget about adults. Look at children. If according to the data, India is the second highest when you talk about children's obesity, and that's extremely worrying. And then you have reports such as this across processed food, across packaged food, and most importantly, very sadly, infant, baby, toddler food as well. Added sugar, the amount of added sugar varying across countries is extremely worrying. But Dr. Shikha, can labeling change in India? Do we need to relook the way labels are done in India? Rather than just having an added sugar, you have fats, you have sugar, and you have so many other aspects. And we had a parent here just speak about that as well, Ms. Swati, and she was talking about how you have color labeling as well in countries. Can't India move towards that direction? Particularly, let's start with children and baby food.
Yes, absolutely. It's high time that India moves to a simpler labeling formula, which means that it, like in many countries, you see color coding, like from A, B, C, D, E, and it shows that A is the best and E is the most unhealthiest product, and it just labels it as that in a simple form. And I think considering that any food product, any processed food product is so complex with tons of preservatives, chemicals, sugars, fats, and trans fats, and a normal person cannot really read the label properly and understand that label. So I think we should have a simpler color-coded labeling system, which has to be an interdisciplinary approach, which means that there should be medical experts, nutrition experts, food experts, packaging experts who together come and design that label. Because without that, people will be totally lost and they would not know what to buy. And a simple claim like for example, on many of the plant-based oils, hydrogenated oils also, it says zero cholesterol, which technically is true because plant oils don't have cholesterol, but it has trans fats, which is worse. So labeling guidelines have to be very simplified.
Dr. Prashant, to parents, to stakeholders, to government officials, anybody, to corporates who are watching us, who will watch us at some point, why is sugar a big concern, particularly for children? Why is it harmful? Why is added sugar harmful? In fact, some would say you don't even need that full glass of a fruit juice that you give children. Let them have the fruit and not the full glass of fruit juice. Dr. Prashant.
Yeah. So I completely agree with a lot of what a lot of panelists have said, that sugar in its raw form or free sugar is is a problem because it can lead to long-term problems with children, especially as they grow. They can have long-term diseases like definitely childhood obesity is one, and obesity in adulthood, and then cardiac issues, heart disease, atherosclerosis, fatty liver, and then metabolic problems, and then all these metabolic problems. Being an oncologist, I do understand that there is a link between this metabolic state and malignant disorders also, and cancer also. So all these problems can increase if you are feeding high sugar diet in childhood. So I do agree with that, and we must restrict free sugars for our children, and there have to be regulations in place to do that. Also, we should prevent our children from developing a sweet tooth by feeding them sugar. And in fact, there are recommendations to feed bitter foods also to avoid developing a sweet tooth. And because these preferences, they develop into adult preferences, and they start preferring sweet food, which also increases your calorie intake, the total calorie intake. Because all you look at the lifestyle issues in adulthood, you will find that having calorie excess, it is at the root of many metabolic issues. So having such a diet will increase your calories, because it is calorie dense food, and it will you know
Okay.
create metabolic disorders. So we should have better regulations and more stringent regulations, and
Okay.
standards probably.
I'm being told by my director I barely have 2 minutes more. Dr. Shikha, very quickly, if you can come in, to parents who are listening to you, to parents who are working round the clock, parents who are juggling jobs in their office and children at their homes, what option do they have? Because they are reaching out very often to packaged food. They may not have the time to really sit and cook up. So what would your advice to them be?
I would say that if you do not have time to have complex meals, make things simple. Like have fruits in your refrigerator. Have different nuts, mixed nuts, like you have almonds and you have different nuts, or you can give peanuts or different kinds of nuts in your refrigerator. Make sure that some of the foods which have a more staying power, you can pre-cook and refrigerate them or freeze them, and that would be far healthier than a processed food which has a lot of synthetics and chemicals. And most importantly, a lot of, like, these are winter times, make lots of soups, make lots of vegetable smoothies, keep them in the refrigerator, and you can give in smaller portions. So it's something which are like just you can run in a mixie. Make more of those things and give them, because fresh food is like 100% healthier, and it will save you trouble and those visits to the doctor and the pediatrician, because the kid is constantly falling ill, has gut issues, has allergies, asthma. So a little bit effort made right now will save you all those trips to the hospital,
Right.
which in these winters parents are doing.
Right. Thank you very much. In fact, we are so invested as parents, as a country, in what our children study, and where our children study, which school do they go, even if they're going to the kindergarten, which college do they go. I think a lot needs to be done to just change the mindset around, and just to see what goes inside that spoon or that hand that's going inside their mouth. And that will also have very long-term dividends. Thank you very much, Dr. Shikha Sharma. Thank you very much, Mahesh Zagade, as well as Swati Mundhra, for joining us. And of course, Dr. Prashant Mehta, thank you for your time. It's time for a very short break. On the other side,